Hello and welcome, it's Chris from Christopher Holt Training, and welcome to this tutorial where we're going to be looking at 4 steps to help you overcome your lower back pain. Now, these steps are universal between chronic lower back pain, which is pain that you have for 3, 6 months to a year, or it can be the episodic lower back pain that you might experience just a couple of times a year. It's just how you use the steps is slightly different. So the 4 steps. First one is identifying pain triggers. So movements, postures, positions and loads that are triggering or exacerbating your lower back pain. Step 2 is then starting to focus on pain-free movement and what movements, postures, positions and loads that relieve the pain. Step 3 is then monitoring that, and is your pain getting better or are your episodes of pain getting further apart? And finally, step 4 is starting an exercise and stretch regime. Now, step 4, for people with episodic lower back pain, as soon as you're out of pain, you kind of have a license to start exercising and stretching. And the same goes for chronic, but that's just going to be a much longer period. People with episodic lower back pain will tend to be in pain for 2 to 3 days, possibly a week, then it will settle, then we can start using the exercises and stretching. What will happen with people with chronic lower back pain is it will just start to reduce. So you might still have lower back pain every single day, but it starts to reduce. Or you might just start having half a day where it's improved and then it comes back again. So you kind of got to make sure that you're getting to a period where you're out of pain, or you can at least manage yourself being out of pain, and then you can start the exercise and stretch regime at the end. So what we're going to do now is talk a little bit more about the 4 steps as a whole. Step 1 is identifying postures, positions, movements and loads that trigger or exacerbate your lower back pain. So all you've got to do is literally sit down with a pen and paper and just start noting down all the times where your back pain has gradually got worse. What were you doing? What movements were you doing? What positions were you in? What postures were you in? What loads were you carrying? Were you carrying anything at all? Start writing all of that down. What we can then start doing is start then thinking about the opposite question, which is then what movements, postures, positions and loads are relieving your lower back pain? What ones are making it feel better? And what we can then start doing is start putting them together in pain-free movement when we get onto that. So thinking about, is it walking? Is it when you're sat in the car? Is it when you're sat at your desk? Is it when you're gardening? Is it because you were moving house and you had all these boxes to pack and then you had to load them, and then you had to unload them at the new house and then unpack them all at the new house? So you've got to start thinking what is, in a sense, triggering or causing my lower back pain to happen. Once you've got that list, you can then start moving on to step number 2, which is then implementing that and starting to build pain-free movement. Step 2 is all about pain-free movement. So what we're looking at here is what positions, postures, movements and loads relieve your pain. So in a sense, it's just asking the opposite question. So going through on, again, a piece of paper with a pen and just writing down what are all the postures, positions, movements and loads that are then relieving or helping me maintain my pain-free movement. One example, it could be walking. So what we could be doing if we get back pain after, say, 5 minutes of walking, what we might think to do is stop at 4 minutes and then maybe on a park bench, we just lean, take a bit of pressure off the lower back and put it on the arms. Or we lean onto a tree, again, take the pressure off the lower back, put it onto the arms. So we're starting to think about what we can do to overcome, or in a sense, prevent, in that example, it coming on. And then what that then allows us to do is go on another 4-minute walk, rest, 4-minute walk, rest. So we can, in a sense, do a 16-minute walk, but with 3 breaks in between. So it just gives our back that little bit time to recover and rest. So what we're identifying is the very everyday postures, positions, movements and loads that can help you relieve that lower back pain. You don't, at the moment, really need to worry about, is it my disc, is it muscular problem, is it this, is it that? If it keeps going, then you might need to investigate a little bit further. But for now, it's very much worth trying to figure out what's triggering it and then focusing on pain-free movement and can I overcome that. Step 3 is monitoring it. So over time, as you start putting these steps in place, so if you get pain in extension like so, what you might be doing is thinking, well, okay, when I reach for my seatbelt, what I'm going to do is I'm going to hold myself in, I'm going to twist my body in the seat, and then I'm going to pull it down and connect it. If it's pain in this position, what I'm going to do is I'm going to come down onto one knee so I can do whatever I need to do without the rounding of my back. So it's thinking about all these different types of things and then thinking, well, okay, now that I'm doing these things, is it getting further apart? So are my episodes of lower back pain going from once a month to once every 3 months, or once a week to once a month? So you've got to be thinking about when that's happening. So for the people with episodic lower back pain, yours is going to be over a much longer time span, because you might not get back pain until 6 months down the line. So you've got to think, in 6 months, I've got to be thinking about, oh, hang on a minute, this is where my back pain would normally go. Is it happening? Can I be more cautious? And can I push it to 7, 8, 9, 10 months? People with chronic lower back pain will be able to get much more instant feedback, because if it's in that example, when I get pain when I walk for too long, then if we can do a 4-minute walk, rest, and then another 4-minute walk, you've got instant feedback that, is my pain there or is it not there? So you can start thinking about it in that way, and it gets much quicker in your improvement, let's say. So when we're monitoring it, those are the types of things that we need to be looking for. And those are the types of things that, or mindsets that we need to have, and attitudes that we need to have, because we need to be thinking about that pain-free movement all the time whilst we are out in everyday life. Step 4 is starting an exercise and a stretch regime. Now, an exercise and stretch regime is not a fitness regime, it's a therapeutic regime. And this is what we need to start thinking about, is can we use our exercise and stretching to continue the good work that we've done with the pain-free movement? Can we continue that with exercises and stretches? So, typical example is, what I want to do is I want to use the 2 lists that have helped me identify my back pain triggers and my back pain removers, let's say. So what we might find is that when we go into this position, my back really starts to ache. I've been gardening, I'm in some raised beds or whatever, and it really aches. So what we've got to think is we've got to select exercises that don't put us in that position. We've got to select exercises that put us in more of that neutral position. So that could be standing exercises, it could be static core exercises like planks and side planks and things like that. But we want to try and avoid exercises that cause us to go into that position. The same with extension. If we are reaching for our seatbelt, as I've mentioned, we get back pain, we want to avoid exercises that avoid this type of position. So back extensions would be out, and various things like Supermans and reaching, using that back extension. So we want to try and remove all of those. And we've got to start selecting exercises that build up these core muscles so they build stronger cores, but also we need to be focusing on the hips as well and getting our hips functioning correctly. Because when it comes on to stretching, what a lot of people do is they want to stretch their hamstrings and they want to stretch their lower back. But what we find is that they aren't tight because of the lower back per se. They're tight because the muscles of the hips aren't doing their job properly. So if we can stretch through the hips, we will start to release the tension in the lower back and the tension in the hamstrings. So just by bringing the hips and the torso back into balance, that will start to allow the body to do what it's there to do and what it's built to do, and that is be healthy, strong, and keep you, in a sense, moving forward in life. So those are very simply the 4 steps. Now, there is a lot of individuality to it, so you will be tailoring something that's very specific to you, which could be completely different to someone else. So do take the time to make those 2 lists, because that's the most important bit. That's the foundation then to steps 3 and 4. So what we've got to be able to do is do all those 3 steps. If you have episodic lower back pain, you can start exercise much sooner. If you have chronic lower back pain, it's very much an idea to focus on pain-free movement, reduce your back pain, and then start focusing on exercises and stretches. Many thanks for watching. I hope this has been helpful for you. Hopefully it's given you a bit of clarity as to what type of steps you need to be taking to overcome your specific lower back pain. If you'd like help with it, you can look in the comment section below and look in the description below, and you'll see a link there that will go through to my online service where you'll be able to engage and work with me to be able to overcome your lower back pain. I take you through a 13-step questionnaire. Comes through to me, I read it, I then give my recommendations and advice based on that, and then in 7 to 10 days I will then follow up again on that and see how you're getting on and see if there's any improvements or changes that we need to make to keep your back pain moving forward. So do remember the 4 steps. Step number 1 is identifying pain triggers. Step 2 is focusing on pain-free movement. Step 3 is then monitoring progress. And step 4 is starting an exercise and stretch regime. So many thanks for watching. My name is Chris. I will speak to you in a future video.